going to demonstrate how to administer different types of medication on MAC here. So we're going to start off with oral medications, and these can come in liquid form, which we would use a syringe like this one here. You'd take the medication and draw up the dosage that you're after. The best way to do it with dogs is to, I'm not going to do it, it's okay, hold their mouth open, which might be hard with Mick here, and it's okay, and put in through the side of their teeth if possible, because you don't want to go down the front, because you don't want to shoot it straight down the back of the throat. And then just try and just keep their mouth closed and rub their throat until they swallow. Precautions with this, as I said, would be doing it from the side so it doesn't hit down the back of the throat and cause them to aspirate. The next oral medication you could do would be in the form of tablets. So you'd get your bottle and pick out as many as required. And you can use a pill popper, but sometimes I think they can be a bit dangerous because they're so long and they could injure the inside of the dog's throat. So the best way to do it would be maybe get another person to hold the back end of the dog, pull their mouth up open with the pill in your finger and just push it down their throat. Hold their mouth closed and then rub the throat and the neck. As I said, precautions with that, with the pill popper, maybe damaging the inside of their throat or putting the pill down the wrong hole. The next medication is topical parasite control. So if we're looking at doing flea treatment on Mac, we would take his collar off. Get the correct dosage of parasite control from your pet store or your vet, and take the lid off, spread the fur on the back of the neck, because this is the most ideal place to do it as they can't reach it and scratch or lick it off. Spread the fur till you can see the skin, which is hard to do, it's really thick. There we have it. Sit still. But it's okay. To the skin down there, and you would just apply the treatment onto the skin and make sure you see it seep in. And then you'd just want to monitor them for the rest of the day and make sure they're not rubbing up on things and trying to lick it off or scratch it off. And the next one is ear medication. So you just want to read the front and see how much the dosage is. This one is a small amount once daily for 3 days into one ear. So you would move the cap on this one, and you may want another person to help with this to hold the end of the dog. And then you would just tip it up, it's okay, hold the ear back and tip in as many drops as you need, good boy, and then close the ear and just rub it like this. And you want to do this for at least 10 to 15 seconds, because the dog will try and shake their head and then it'll just come out the ear. Risks of using this is putting in too much into the ear, and then it might block or get too much fluid in. The last medication to administer is eye medication in the form of eye drops. And what you would do is you would take the cap, you'd read the dosage that is required, take the cap off the top and try and position the dog's head up. Good boy, good boy. Get your droppers and just drop into the inner corner of their eye as many drops as necessary, and then just try and hold their head still for a little bit while it seeps in, because they'll blink automatically, which will push it into their eye. The risks of using an eye drop is obviously poking them in the eye and damaging their eyeball, and putting too much into their eye. Finn. Come here. Just going to show correct handling of how to pick up a small dog onto a bench. Stand up. Up. He knows he's going to pick up. So just one arm around the front of the chest and one around the bum. And place them on the table. And then back off. Run around the front.